everyone. I am Dr. Swarna Goel, consultant obstetrician and gynecologist, working with Lilavati since the last 12 years. Today, I would like to talk to you all about a very important part of a new mother's life, about breastfeeding. When a lady is pregnant or when she delivers a baby, she gets a lot of advice from everyone. Some of it is true, some is untrue. A lot of myths, a lot of facts, a lot of confusion in a very challenging time in a lady's life. She may get confused, she may get upset, she may not know what to do. And she may actually feel whether breastfeeding is for her or not for her. So I would like to break down few topics and discuss a few of those topics in which we'll come to know whether most of the things that we hear about breastfeeding are actually myths and not facts. You will not make enough breast milk in the first few days. This is a myth. In the first few days of life, breast produces colostrum, which is actually liquid gold, rich in nutrients and antibodies, and enough for a newborn baby. If the baby is constantly crying, that means you're not producing enough milk. Again, this is a myth. Babies cry for all reasons. That is the only way they know how to communicate. So baby may be tired, may be wet, the diaper may be wet, baby may be colicky or having a nose block. Or actually the baby may be hungry as well. But the only thing the baby knows how to communicate is to cry. So moms, don't get worried. It's not that you're producing less milk. There are other reasons why babies cry. You cannot breastfeed your child if you're unwell. You cannot breastfeed your child if you're on any medication. Both of these are myths. Mothers can continue breastfeeding the child if they have mild fever, a urinary tract infection, cold or cough. Do consult your doctor before doing that. But remember mothers, if you're breastfeeding your child when you're unwell, your baby is actually receiving the antibodies to these illnesses that you have in your body at that time. So it's important that you continue breastfeeding your child when you're unwell. You cannot breastfeed your child if you're on any medication. Again, this is a myth. You should speak to your obstetrician. There are medications which are safe in lactation. And if you're taking any of those medications, you should continue breastfeeding your child. You cannot breastfeed your child if you've gone back to work. Again, this is a myth. Most of the modern mothers are able to make a healthy balance between work life and a life as a mother. Many offices and workplaces have facilities where you can pump and express breast milk, store it in a freezer, and then thaw that milk and feed same milk to the child once you get home. So you should not stop breastfeeding. You can make a minor adjustment and continue breastfeeding even when you resume work. Another piece of advice which pregnant ladies or new mothers get: do not breastfeed your child or you'll get saggy breasts. This is a myth. Breasts don't get saggy because of breastfeeding. They get saggy because there's been a rapid weight gain or a weight loss, some hormonal changes, the natural aging process that happens. Breastfeeding does not make a breast saggy. You cannot breastfeed your child if the breasts are too big or too small. This is a myth. All mothers are able to breastfeed their child irrespective of the shape or the size of the breast. Minor adjustments may have to be made according to the shape or the size of the breast to feed the child effectively. Various different positions may be used if the breasts are small, and various different positions are recommended for very large breasts. You cannot breastfeed your child if you have undergone any breast surgery. Formula is as good as breast milk. This is a myth. Breast milk is the best milk. Always remember that, mothers, because breast milk changes according to the different development stage of the babies. It's rich in nutrients, it has antibodies, it helps mother and child bonding. Also, it is safe, it is free, and it is readily available without any extra effort required, which is required for formula milk. Breastfed babies become spoiled if they are breastfed for a very long time. This is again a myth. If anything, breastfeeding improves the mother and child bonding. Breastfeeding mothers cannot have an active social life. This is a myth. Mothers who rejoin work have learned the art of balancing work, home, babies, and breastfeeding, and the same can be said for a breastfeeding mother who wants to regain her social life again. Minor adjustments are made and the breast milk is expressed and stored and given later on by the caregiver of the baby. Breastfeeding will prevent you from getting pregnant. This is a myth. Even though a mother may be breastfeeding her child and the periods may not have come back, but it has been shown that after 4 to 6 months, the fertility does start coming back, even if the mother is breastfeeding and the periods are not back. New mothers, do remember, breast milk is the best milk. It needs a little hard work and patience, but you will experience the wonder of breastfeeding. You will experience the joy of having a very strong mother and child bond. You will be giving your child good nutrition, a lot of immunity, and it will bring the family closer. So be motivated, work hard, and ensure that you exclusively breastfeed your child for the first 6 months of the baby's life. Thank you.